Hey, welcome back, everybody, to Good Day Tulsa. Imagine a beam of radiation that tracks its target and attacks a tumor without harming surrounding healthy tissue. And it's completely non-invasive. It may sound like science fiction, but it's reality, and it's saving lives. Dr. Diane Heaton, who's medical director at the Oklahoma CyberKnife, is here this morning to tell us all about this extraordinary technology, along with a CyberKnife patient, Ronald Fleming. Appreciate you both coming in today. Thank you very much. We're going to start with you, Doctor, and tell us a little bit about CyberKnife and how it's completely different.
CyberKnife is quite a bit different. There's really two ways to do radiation. You can divide it into many days, or you can divide it into many beams. And we do the division into many beams and then cut down the number of days from 1 to 5.
Yeah, so you can kind of eliminate surgery in some aspects,
Yes.
perhaps as far as chemotherapy, radioactive treatments, so...
There's no doubt that we are able to do a lot of things in very short, very precise abilities and treat things that we really couldn't treat before.
And that's how Mr. Fleming found out about CyberKnife. You were telling me, what, about 2 years ago, sir, that you were diagnosed with kidney cancer, is that right?
Right.
And then what happened? You were telling me they told you were going to have surgery?
Yes, sir.
And what did you think at that point?
Well, I didn't want to go through another surgery after going through heart surgery. So.
And that was just a couple years prior to that, right? So yeah, you were worried about that and about the effects of that. So what did you said you started doing some research?
Well, I saw a commercial on TV, and then I got online and kind of researched it on the internet and found out that, you know, they had a CyberKnife here in Tulsa, and made an appointment to talk to Dr. Heaton, and one thing led to another.
Well, I started to say it was pretty fast, really, the process, wasn't it, once you got started?
It was very fast.
And what was it like for you? I mean, as we're taking a look at some of it right now, what was it like for you? Is it everything that you thought it'd be, different than what you thought? It
was pretty much like I thought. You know, you just lay perfectly still, and the machine does all the work, so. It's not invasive, so that's the best part.
I started to say it eliminated the need for surgery.
Right.
You didn't have to stay in the hospital.
Right.
The chemotherapy, perhaps, that you would normally have to go through, none of that for you as well.
None of that.
Yeah.
Went through 3 treatments, so it was relatively pretty simple.
So you come in and you're able to just leave?
Oh, yeah.
Does that surprise you at all?
I went back to work the next week, you know. So, I mean, I was tired the first couple of days, but that was about the only side effects I really had.
Now, I'm sure that Mr. Fleming is probably like a lot of other patients you guys have at CyberKnife. What are some of the things that a person can expect? I mean, you kind of mentioned there's certain things that you guys can do with CyberKnife.
Yes. There's a number of tumors that we can treat with CyberKnife: head and neck tumors, spine tumors, prostate, pancreas, and renal cell or kidney tumors are a lot of tumors that we're treating at this point in time.
Now, Mr. Fleming said he came in for 3 treatments. What's his prognosis right now?
Excellent. We're showing 80 to 90% control rates for his size tumor, so I'm expecting him to do very well.
Wow.
Yeah.
Well, that's awesome. Thank you, sir, and congratulations.
Well, thank you.
Yeah, if you'd like to know more about this, Oklahoma CyberKnife, amazing, 6820 South Olympia Avenue, 71st and Highway 175. 949-6676. You can also go online to Oklahoma CK, which is cyberknife.com. Mike?
Well, hey, you know what? Switching gears, imagine getting $439 worth of car maintenance for only $90. Better